Hey everybody, it's so great to be here tonight with all of you. So I'll give you a little bit of a background about myself and some of the healthcare insights I've developed over the course of the last 15 years in practice, about 12 in healthcare leadership, of which a significant component has been being co-founder of ProMed AI. And then I'll give you a little bit of an intro into ProMed AI. And it's actually very much a companion presentation to Anne's presentation, which is completely unintentional, but works out great. So it's very good. A little bit about my journey. I've held several different leadership roles over the course of the last 12 years and at various levels in the system, and certainly the COVID pandemic was an important time for me in terms of my career and where, changing direction. And as much as those leadership positions are important, also, having the opportunity to be a patient and a family member is actually what it's truly all about. And obviously all of us are patients at various points and family members as well. And those are the things that really kind of ground you and bring you back to like what this is all about and what we're doing and really kind of help shape, the direction that I've gone and some of the challenges that I see in the healthcare system. We had earlier on when Vijesh was asking about the current state of the healthcare system, several people had put up their hands noting that it does seem chaotic. It doesn't seem like it's exactly quite right, and that bears in the data. So when you look at Canada with respect to other OECD countries, we actually rank amongst the highest in terms of healthcare spend. But what we're actually delivering on, the outcomes are actually very poor. We face amongst the highest wait times relative to our peer countries in OECD averages, and when you actually look at how much we're spending relative to our GDP, we're actually spending at 1.5 times our GDP. And the actual metrics that matter with regards to spending efficiency and access and wait times, they're suboptimal and they're below our peer countries. So you look at the ones that you always hear about in the news, like referral to specialist or OR wait times for hip and knee replacements or frequently imaging ones, we're underperforming. Our actual spend, we actually spend 55 to 75% on chronic disease management. Coincidentally, we also are amongst do the least investment in primary care and preventative care, which we'll talk about in just a second, because that's actually a significant opportunity. And with regards to our systemic implications, we're actually much more focused on reactive care than a lot of the proactive care. And reactive care is obviously very bad for the patient and also very costly for the system. So there's a growing strain on our system, and when you actually look at our access to proactive care, people don't actually even have access to proactive care in Canada and the US, with 1 in 3 Americans lacking vital access to a primary care physician, and for Canadians, 1 in 5. And the statistics are 60% of people actually live with preventable diseases. So you could imagine if you can actually prevent those diseases from actually coming, there'd be a significant cost savings and much better for the patient. But what's actually happening, we're so focused on reactive and acute care, we actually can't do that. So you manifest the disease, terrible for the patient, and also very costly for the system. And you end up in this swirl. When you look at the care continuum, starting with reactive care, then going to proactive, predictive, and personalized, reactive care, we do reasonably well. Like you develop coronary artery disease, you have symptoms, you come to the hospital and you get treated, and then you go on your way. However, you have the disease. And then it's actually managing that chronic disease for the rest of your life, where there can be actually significant impact to your morbidity and mortality. Proactive is what we try to do with regards to screening. It's very population-based and episodic. We try to do this, but it's one point in time. Predictive is the area of space where certainly ProMed AI has a lot of activity, leveraging current digital tools and advancements in AI. We're actually being able to monitor this ongoing risk over time, which actually has significant impact. And then personalized medicine is, of course, the holy grail, where we can actually deliver personalized treatments based on your biology, your behavior, and your environment. And that's certainly the way of the future that we're working towards. We've talked a lot about the current state of the healthcare system and the relative underperformance relative to our spend. Also important to consider the patients. Like they're ultimately at the center and the heart of this. Who are the patients and have they changed? And certainly in the course of my career, they've completely changed in the course of the last 20 years. Whereas before you would just go to the doctor and you would get your results. You wouldn't question the results. You wouldn't be able to get the results. You would just be told what the results were. And then you would go on your way. patients now are far more informed, they're data-driven, they're connected, and they're expecting data-driven experiences. 85% of Canadians have a smartphone, 4 in 5 want access to their personal health information, and then 1 in 4, 1 in 3 are using wearables, multiple wearables, and various health apps. So our patients have completely changed, and the care that we want to deliver to them and how to take care of them has to change as well. One, I had heard in your presentation that there's a lot of concerns about health information being given to patients, and like, can the patients actually manage this information? What's going to happen? The reality is, patients can. If we actually, patients can interpret the data so long as we actually design it for them and we design it with them. So instead of patients really just being passive recipients, and over the course of the last 20 years, Google researchers trying to figure out what they actually have, they can actually truly now become true partners by enabling them, giving them the tools, and we certainly have the sophistication in our digital tools, in our AI technology to actually design this for them. So this not very good at this. This presentation is a little bit of a snapshot of a longer one I do that's probably about 45 minutes, where I make the case for why healthcare is ripe for an evolution right now. We've talked about some of the financial strain and the rising complexity and patient evolution. We won't talk about the workforce crisis and data explosion, but certainly these 5 compounding forces really make this a clear opportunity and a clear inflection point for healthcare systems around the world for why healthcare is ripe for an evolution. And certainly digital tools and AI integration are really going to be that connective tissue. Many folks in this room obviously know about the AI healthcare ecosystem, and this is just some of the examples of where AI is being deployed. Very practically, the farther you are away from the patient, it's probably where there's actually the most activity because it's easier for adoption, it's fraught with way less regulatory. The closer you get to a patient, which actually probably has the biggest impact, is really the hardest area. But as we're at the very beginning, as time goes on, we're going to move closer to that end of the continuum. But it's certainly, we were seeing activity in that back end, back office space. Again, moving closer towards the patient is actually where the real impact can be. So why AI and how to actually use it? So here the language actually matters. If you come in and say, AI is going to replace you, you're dead on arrival. Like, nothing is going to happen. It's going to be all systems stop. The reality is AI is an extender. We have the opportunity to personalize risk over time. We can translate clinical complexity to patients and users with meaning, so they actually understand what to do. We can support earlier, lower friction action to reduce system burden. So we want to be able to scale clinical judgment and context, where we do not want to bypass clinicians. And certainly at ProMed AI, we're not looking at taking users away. We're trying to enhance relationships and bring actually people and providers and services closer together. And the opportunity is bright. I think what will matter most is going to be trust over speed, responsibility over hype, and empowerment over automation. And it's not really what AI can replace, it's really what it can enable. And certainly a nod to the complexity of the healthcare system. And certainly, the folks in this room have tenacity, which is absolutely important. Healthcare is not a jet ski. It doesn't pivot. It's an ocean liner, and it turns, and it takes a lot of time. But certainly with the tenacity, with some of those changing forces, I think we can certainly get to a much better place than where we are. I also think that patient evolution is a significant factor because patients are going to be demanding things that the healthcare system can't actually deliver. A little bit about what we're doing at ProMed AI, and we're certainly proud to be a partner with Mayo Clinic Platform Accelerate. We're one of 11 companies around the world that has the opportunity to use Mayo de-identified data to train our AI. Very proud of our partnership with them. Your proactive AI healthcare concierge, we're always on, clinically validated. We take all the information from users using an evidence-based questionnaire, your lab data, your wearable data, your genetics, your 24/7 lifestyle data. We're able to actually give you proactive insights, categorize risks, and actually develop action plans. How it actually works, we receive your data, our AI is able to analyze your data, we provide those proactive insights, and then we actually do all the actions, and that continues all the time, every minute of every day. We're live with blood tests and wearables. Our DNA testing's in beta with good early responses from our users, and soon will be complete end-to-end coverage, which we're looking forward to launching in addition to a few other announcements that are forthcoming in the coming months. Certainly, if you're interested, you're more than welcome to sign up. Happy to take any questions.
Thank you, Dr. Ivan. We'll take 2 questions. Okay.
Thank you. That was awesome. Great presentation. I'm a healthcare strategy consultant, and I've written a lot of strategic plans, going back to the last presentation as well. And I think a lot of the time we spend time thinking about where the decision's made at the high level. But I want to go back to the patient, and I liked your point about staying patient-centered. They're at the heart of everything we do. But what does that actually look like, in your opinion? Is it working with patient advocacy groups? Is it focus groups? Like, what does it mean to actually get the patient's voice integrated? And I like the saying, like, nothing for us without us, and
Yeah.
I think that resonates in a lot of ways in healthcare. So yeah, I'd love to know your thoughts.
Yeah, so I had a few of these conversations before the event started along these lines. So obviously with our company, there's a lot of interest at various enterprise levels for the products and services that we're offering. But we of course are also direct to consumer. And one of the things I love to direct, and those of you that are in the business know that direct to consumer can be very complicated and takes years off your life sometimes. But you learn incredible information because they're the ones who matter. And then also, there's a sophistication that you can develop in being able to roll up into themes and knowing what to execute on. The reality is that the patients are everything, and their voices are the ones that matter the most. And everything else follows that. And that's, sometimes it feels like a catchphrase but that's the truth. Like that's exactly what it's all about. So I think when there's actually a patient advocacy group that I'm connected in with, they're ultimately the ones that have all the answers, and they're really the ones that are helping drive this forward. They didn't have this opportunity 20 years ago. They do now.
Hi, yeah. Hi, yeah. So, great presentation. My question is mainly around the predictive nature that you highlighted, right? So you showed a progression from, am I audible? Yeah. So you showed a progression from going from reactive to proactive to predictive. And what ProMed, so we are trying to build in the similar space. And what I noticed is that you are also pulling in all wearable data, and you're doing things like using HealthKit, or maybe having a high sampling frequency like Whoop and Aura and everyone. But then what I notice is that everyone stops at the reactive layer or like the proactive layer. But then what I fail to understand as an outsider is that what is preventing large scale companies with all these high quantity of wearable data to go to the predictive layer? Like, is there some like TARPET idea or concept where everyone tries to, but then eventually realizes you can't, and then they stop at the proactive one? Like, what would unlock the predictive angle?
Yeah, I think this is in its infancy, and actually bringing this together. Like very often we think about healthcare as over here, and kind of wellness over here, and fitness over here, and nutrition's here. They're actually all together, and they're all interconnected. I think it's merging into a Venn diagram conceptually, infinitely slowly, but ultimately it's actually one circle, I think. Yeah, I think that they will be coming together, and interpreting that information, I think, is actually quite complicated, and I don't think we necessarily have that expertise out there, right? So if you're actually integrating all your information about your nutrition, your fitness, your VO2 max, your wearable data into the context of your healthcare biometric data and what you're doing, that expertise to actually put all that together is actually, first of all, very complicated. I don't think we have, certainly at scale, I don't think we have an ability to do that. And the reality is this is actually where we leverage AI to actually help do that for us.
Hello? Okay. Hi. Yeah, great presentation. I'm also a big fan of that vision, the predictive, preventative, and personalized care. I'm wondering, in terms of your data inputs for the blood work, are you currently pulling in all the lab tests from Ontario for the lab test? And also, are you guys having your own blood test for the biometrics? Because right now I have to go to a U.S. company to do all my blood scans.
Yeah. So a couple things. So number one, so when you subscribe, we'll start with a panel, and we have a few different options. So one, you can actually do your blood work through Life Labs with us, and as well as we have some other at-home options as well.
Thank you, Dr. Ivan. Thank you so much. A big round of applause for Dr. Ivan, please.